Views with me, Julie Alli. You're tuned to Salam Media, and next online we'll be talking with Dr.Shahida Omar. She is with the Teddy Bear Clinic, director at Teddy Bear Clinic. And we know that last week saw Child Protection Week rolling out. And we also know that we shouldn't just be talking about this very important issue 1 week in a year. What I do want to talk to Dr. Shahida Omar is the issue around middle-class families and child protection. Do we as middle-class families believe that it's not our problem? That these kind of things don't happen in our homes, in our families, in our communities. It's something that, other people, the poorer communities, need to worry about. Dr. Shahida Omar, Assalamu alaikum. Welcome to the program, and always nice talking with you.
Shukran. Thank you for this opportunity. I think it's important to realize that middle-class families are in a total state of denial. They actually feel that it's somebody else's problem. They're exempted from the scourge of violence or maltreatment of children. Unfortunately, what we are seeing is that many children coming from across the spectrum, whether it's middle class or whether it's your poorer socioeconomic classes, are all being subjected to some or other form of abuse, whether it's physical abuse, emotional abuse, neglect, and even sexual abuse.
Shahida, when we look at middle-class families, parents possibly are professionals or career people, and in most cases do try and provide to the best of their abilities. Their children probably would be attending government schools, and they do provide, I can't generalize, but by and large, you do provide for their children, trying to give the best to the kids to the best of their ability. You talk about sexual abuse, you talk about neglect. Can we see this playing out in these middle-class families where you have parents who are probably professional people?
Absolutely. If we look at the middle-class families who are working so hard and providing so much for their families, particularly their children, what we are seeing is that children are overexposed to the internet, not adequate and appropriate supervision and monitoring. And if we just look at the influence of child pornography and exposure to explicit sexualized images and information, children are certainly, or by the age of 8 years old, have already had exposure to child pornography. So what we see is children acting out on other children, children even bullying other children. This has been played out at schools in all income groups. And middle-class families are certainly not released from this violation.
How do we socialize our children, Shahida? How do we protect them for them not being exposed to this, to these type of scourges? And also, I also kind of think as I pose these questions to you is I wonder, in our zeal of being the perfect parents and expressing our love to our children, do we give them too much too soon? What is that doing to them? Let's look at that as a scenario, and then we move across also to poorer households. And I should imagine then perhaps the situations are slightly different. What is their abuses, child neglect and abuses look like? So let's look at the two scenarios separately and see when, how parents can and should be better parenting their children.
So if we look at the first scenario of your more affluent or middle-class families, we find that parents are certainly struggling in terms of communicating with their children. The important thing to understand is that children are given devices, but parents are actually not equipped and trained on those devices themselves or sufficiently trained. So there needs to be greater engagement, communication, and of course empowerment around the usage of these devices. So parents need to practice, but also ensure that they communicate, there are ground rules, and that they are aware of the dangers that are lurking out there, and ensuring that they talk daily to the children about these things. Middle class families, we find that parents are so busy working hard and trying to generate a certain level of income that the opportunities are not created for actually communicating with children. With your poorer families, the challenges they faced with is unemployment or loss of household income, overcrowding, the poverty, and the challenges of, where they're going to find their next meal to provide for their children. So the frustration, feeling quite helpless and helpless in the situation, increases the anxiety levels and the stress levels. And again, it's not the best parenting that comes out. Their way of responding is sometimes inappropriate, harsh, and punitive. And of course, that perpetuates the cycle of violence.
I have no doubt in my mind that the lockdown has impacted severely on both situations. How do parents then try and better the home situation for the child?
So, Julie, I think this is more of a systemic challenge. Yes, parents need opportunities on how better to parent and also to understand the difference between discipline and punishment. Government departments and civil society need to actually organize lots of opportunities where parents are allowed a platform to learn about better parenting. It's, parenting doesn't come with an instruction manual. So I think these are, things that, or programs that need to be I would say, mandated. And whether it's in the workplace, in the healthcare setting, but opportunities for parenting should be actually instituted and implemented.
We heard about horror stories coming out of private schools. We hear about bullying that happens at private schools, and it kind of, perhaps it shouldn't be a surprise, is that the thinking is that the children at those schools have parents who are professionals, well educated themselves, have live in good, come from good homes, live in good suburbs, have everything of the best. Why do we still see bullying in that scenario? And perhaps, it's not the right thing to say, but when you hear about bullying from a child that comes out of a squatter camp or a poorer home, you kind of think, okay, the situation is not conducive. The child's been exposed to way too much violence, way too much of the gritty side to life, and that is why he or she's perpetuating what he or she's been exposed to.
So you raise something so pertinent, because in your middle class families, what we have seen from children and heard from the voices of children is that physically parents are available, are providing far too much, but emotionally the availability, the emotional connection is something that is lacking. And children are acting out and trying out for that kind of response and connectedness.
And thus, they behave badly, they behave poorly. Last week was Child Protection Week. What was the theme for last week? And I know every year that, there's a different theme. So what was it for this year, so to speak?
Well, this year was let's all work together to protect children during COVID-19 and beyond.
Have you seen an upsurge in child neglect during the lockdown?
So we have seen a lot of child neglect cases where if we look at your poorer communities, it was not purposeful neglect. It was situational neglect beyond their control, where children were not able to access health care or even the food insecurity. I think those were situations where parents could do nothing about it because of their financial challenges and the economic climate that they've been faced with during lockdown. If we look at the more middle-class families, it was, again, the situation was different, where parents did not deliberately oversee their children, but were too involved with trying to address just the whole situation around COVID, not coping with it. And I think that was something that children were again left to their own vices.
Shahida, I know this is difficult. Families differ, dynamics are different. There's cultural and possibly even religious issues to be taken into account when you're trying to be the perfect or a good parent, so to speak. What would you say would be the 3 or 5 classic rules to follow, whether you're a poor parent or a middle class parent, in terms of raising your children in a very healthy environment?
So I would say the first important thing is that unconditional love. Loving your child and accepting your child for who he is or what he is. But at the same time, unconditional love means that there are ground rules. You separate your child from the behavior where you say to the child, I love you no matter what. But the behavior which is inappropriate or unacceptable will not be tolerated, and there will be consequences. So, of course, it's expression of love, being consistent in your responses, communicating regularly with your child, but also modeling. So what you're expecting of your child, you need to act out on that consistently and be a constant, emotionally available parent or caregiver to your child.
What sort of consequences would be fair? And I know that you are totally against punitive action. Schools and government has also passed a ruling about no corporal punishment. So what sort of, and I know it would differ from family to family as well, depending on your financial and social situation.
So I think the one thing we need to understand is that sparing the rod and saving the child.
Saving the child, not spoiling the child. Lovely.
So it's about investing more time in communicating. We talk about ground rules and things, that would be practical in terms of time out, in terms of things that children enjoy, activities they're active, and giving the child choices to say, if you choose to do this kind of behavior or engage negatively, you choose not to have that, or you choose to be deprived of whatever activity. I think it's talking in the language of empowering children, But again, one needs to do this regularly. Sit down, write it down. Get the child to write it down. Get the child to repeat it so that it's reinforced, but also to understand if the child has understood it. So it requires a lot of time, but also having family meetings, once a week, but at the end of each day, also affirming your child for all the good and positives that he or she has displayed or demonstrated. I think that's where we often fail. We are quick to criticize and punish the child, but often fail to actually praise a child or prize the child for the efforts that he may or she have actually done.
Sound advice indeed, Shahida. It's 9 o'clock. We need to take the news. Jazakallah so much for your time and your words of wisdom. Salaamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh.
That was Dr. Shahida Omar from the Teddy Bear Clinic. It is exactly 9 o'clock.
Listen to some